Hello, friends. Welcome to our Zoom session. I am interviewing here Mr. Gerard Green. He's a UK-based physiotherapist, and our topic is male pelvic pain, which is his specialty, and I'm so excited to hear his pearls of wisdom.
Yeah, thank you very much for the invite, Jeanice. It's a real honor to be discussing this with you, and I love everything that you do. You're a real inspiration, and thank you very much. And also, thank you for not forgetting about the guys, because usually the male pelvic floor patients tend to get left behind. So I really appreciate that.
Thank you. Well, it's such a great opportunity, and I love that we have this ability to connect over technology, and so excited about sharing some tips for males. And by the way, I think you know this, but you may not know how popular it is. The little video that you did about jelqing, it's on our YouTube, and it has like 4.5 thousand views right now. So it is just taking off, and I thank you so much for sharing your information with the world. So let's talk about male pelvic pain.
Okay, so just to maybe put this in a bit of context. So male pelvic pain is, these are men who are getting maybe pain around the pubic area, pain around the scrotal area, penile pain, pain in that soft area underneath that kind of perineum. They may be getting rectal pain. So they're getting pain in that kind of pelvic area. For it to be classified as pelvic pain, they also need to be getting a few other things. They generally may be getting some urinary symptoms, commonly maybe urinary frequency. So that's where they're having to kind of go and pass urine maybe every 45 minutes, every hour. They sometimes get real kind of difficulty initiating urination. And there may be some changes with the flow. And they may also be getting some pain. They may be getting some bowel symptoms. So they have maybe kind of difficulty doing, maybe pain on doing a bowel movement, because the muscles around that kind of rectum are a bit contracted. They may be getting some increase in their pelvic pain after a bowel movement. And the other big thing, probably about 3/4 of these men complain of, is they get real pain post sexual activity. So they get real pain post ejaculation. So, and it's not that they get a little bit of kind of discomfort. They get real flare-ups for maybe a day or two. So masturbation, any kind of sexual activity with someone else, any penetrative sex, really leads to a flare. And they also get some kind of changes in erectile function. So commonly they will get loss of those morning erections. They generally will have a full enough erection to masturbate and have sex, but every man knows if his erection is different, and they will say that maybe, well, I can get an erection, but it's maybe about 90% normal, or it's a little bit fuller on one side, or it takes a bit more stimulation to get it erect, and it's not lasting for longer, or it's not lasting for as long, or, you know, once it's flaccid, they can't get it erect again, which maybe normally they would have done. So that's kind of the group of men we see. So that's male pelvic pain. The other big group that we see is men with Hard Flaccid Syndrome. So these men are much younger. These men are kind of late teens, probably mid-30s. You can have older men with this, but it's generally the younger men. And this is a really awful condition to have, because what these men get is when the penis is normally flaccid, normally you're kind of not really aware it's there. You know it's there, or you hope it's there, but it's not. You're not aware of it.
Yeah.
Whereas these men in their flaccid state, it feels quite rubbery. So it's almost like in a really uncomfortable, permanent semi-erect status. But also they can't get a full erection. So they also get maybe some premature ejaculation, real problems getting that penis fully erect. They also get really really disturbing symptoms such as penile retraction. And what penile retraction is that that penis looks like it's really been drawn up into the body. So it looks shorter. It's almost
like
those,
the head of a turtle.
Yeah, exactly. Right? That kind of turtlenecking, yeah. And it will kind of fluctuate, and sometimes it will look a bit. I think one of my patients this morning actually said, because it's 2 p.m. here in the UK, said it looks like it's shrink wrapped. It's really compressed. It's lost its bulk, and so we see lots of men with hard flaccid, which specialist male pelvic physio can do lots to help, because otherwise these guys are pretty fit and healthy. And the other guys we see are probably the more sporty guys, the kind of triathletes, the cyclists, the footballers, who maybe they've been getting some groin symptoms, but they're now, someone's picked up that groin pain isn't settling, but someone's picked up that they're getting a little bit of mild urinary symptoms, little bit of mild erectile dysfunction, and maybe that pain is also in that perineum. So we see a lot of those, and they're the real fit, sporty guys. And I think the other, although it's not male pelvic pain, the other really group that I'm very passionate about, and I know you are too, is the men who have had surgery for prostate cancer, the prostate cancer survivors. So they don't tend to get pelvic pain, although small minority can, but they get two really big complications of surgery. They all get urinary incontinence. So this could be someone's partner, someone's dad, a work colleague, an uncle. So they've been fit and healthy, maybe playing golf, playing racquetball, going to work, having a full sex life with their partner, their wife, their husband, and suddenly it's been picked up that they have prostate cancer, maybe on a medical screening, and then they have maybe a radical prostatectomy, and then suddenly the good news is that the cancer is being treated and they've had surgery for that, but they're left wearing big nappies because they have no urinary control. So we can do lots to help those guys, and also they have complete erectile dysfunction. So those men, it's like being hit by a truck, like. Does that give an overview of that, Jeanice?
Yes, absolutely, absolutely. So let's say somebody is experiencing some issues with their penis. Let's say the hard flaccid, like they're not getting a good erection, but they're not ever completely relaxed either. What would you do with them? What are some of the things that they can try at home during this COVID period?
Yeah, and I think I did a little bit of research into this in the last couple of weeks, because this is COVID-19 is affecting all of us. It's changed how we're all living, and I was quite interested. Well, how is it affecting men and women with pelvic pain, but also how is it affecting men with hard flaccid? So I put a kind of a call out in some of the Facebook groups, some of the self-help groups. And I think what I got back was really interesting, in that a lot of these conditions, particularly hard flaccid, particularly pelvic pain, is made much worse by increased stress, increased anxiety, changes in sleep, changes in mood. And I know from my own experience, in the first week of this, I wasn't sleeping. I kind of thought, how am I going to support my 4 kids? I was anxious, I was stressed. My mood was up and down. But those patients already have these things because they have these conditions. So I think it's COVID-19 has not been kind to these men, and also their appointments have been kind of taken from them. So it may be that they're seeing a specialist male physical therapist. It may be that they're seeing a urologist. It may be that they're seeing a clinical psychologist. But those appointments, those face-to-face appointments, have been kind of taken by COVID-19. So what can these men do? Kind of getting back to your question. Some strategies to try and do some relaxation is good. That's really important. The belly breathing is really good. Sometimes that takes a lot of explanation to the men, because the men want to be doing exercise and they want to be pushing themselves and they want to be sweating and they want to be working hard. Whereas we're telling them you need to kind of calm down a little bit. You need to, do some belly. And what we do in clinic is we stick an ultrasound probe in their lower tummy, and we show them that if they do some of the belly breathing, the relaxed breathing, it really gets some nice movement through that pelvic floor to get rid of some of that contraction, that overactivity. So we get them doing some belly breathing is something they can do. Something that leads to a bit of relaxation, maybe music, headspace, or just relaxing. These conditions do not like being sitting around all day. Nothing kind of spinal, hip, pelvic floor wise likes to be sitting all day. During COVID-19, we're having to do that a lot, whether we're working from home, whether we're doing kind of Zoom meetings, kind of getting out and doing a little bit of exercise as you're allowed in your community. And we also get them doing almost a bit of kind of movement-based stuff, like a bit of kind of yoga movement for the hip, spine, pelvis. So getting them doing some movement-focused work, rather than, we don't like them doing much strengthening. We try, and a lot of them will be doing lots of pelvic floor strengthening because they feel that that'll help them, but that tends to make things worse. So we kind of stop them doing that. We stop them doing lots of intensive abdominal work, lots of really heavy weights. But we say to them, you'll get back doing that, but you just got to calm that down initially. And I think what we also emphasize is that, although the traditional face-to-face appointment isn't there, lots of your men's health physical therapists or physiotherapists, depending on where you are, will still be doing online appointments. And, today I had 4 online patients. That's an hour each. Yesterday I had about 7. And we get used to it, and the patients get used to it.
This is a little side note, but do you accept patients from all over the world? Are there any specific requirements for you to be able to see a patient?
I think I suppose a bit like you, Jeanice, I am very fortunate in that I am involved in a network of physical therapists. So that, we have met in person in Denver. We know a lot of physios in other countries. So I am a big believer that I think my preference is for people to seek care at least somewhere relatively near to them. So I think what
so they have the hands-on component too.
Yeah. So we do see some patients from abroad. So in the clinic, we have some people travel to us, more so from other parts of the UK, Ireland, Western Europe. But first of all, if someone emails me, which I'm happy for people to email me, but I will say to them, okay, you live in Perth in Australia. So I will say, well, rather than doing a consultation with me online, I will put you in touch with a men's health physiotherapist there. Or if someone contacts me from somewhere else, I'll say, well, let's initially see if there's someone more. So I'm happy for people to contact me, but what we try initially is trying to find someone a bit more in the same kind of geographical area. I'm not a big believer in, say pre-COVID-19, people would say, well, can we travel to see you? And I would say, well, there's a better way to do this, like.
And just, right, like if they're traveling multiple hours on a plane or in a car, and what is that doing to their symptoms?
Exactly.
Good. Okay, so we went over some pelvic pain things. Anything else that you'd like to share with our male pelvic pain audience?
I think we put out, so I knew that I was doing this with you, obviously, or otherwise I wouldn't be sitting on my couch here. So I also so in some of the men's health patient forums, I put out a call for questions, and we've had a few questions back. And I think one question was, you know, having surgery for prostate cancer it's a massive event. And afterwards, sometimes the focus for those men is very much on the surgery, and sometimes the aftercare is not wonderful. There are exceptions to that, obviously, but sometimes the focus is very much on the surgical procedure. So a lot of men were saying, well, you know, I've had my surgery. What happens now? Because I can't see anyone.
Yeah, so it's more, it was the emphasis on quantity of life versus quality of life. So great,
Exactly.
now you can live longer, but what does your life look like if you're having urinary leakage, that you're having to wear full diapers and you have no sexual function? So that's a good point.
So I think that here in the UK, and I'm sure it'll be the same in the States and in other countries, we've got the Prostate UK organisation. They're a very proactive, visible charity that organise a lot of local groups. So every man that walks into our clinic, we say to them, okay, you know, it would be really good for you to go and attend your local meeting. And it's also very supportive for the partners. Now, what we're saying to people is, you know, you can't go to those groups, but some of those groups are coming online. So let's check online to see, are they doing like a Zoom support group? So we try and keep, because that keeps them in touch with other men who've been through the surgery or other treatment for prostate cancer. And it's also really good for the partners, especially, you know, a lot of times some of these men, a lot of the men, it's not the men who contacts, it's their partner or their wife, and they're having a tough time.
Yeah. I think that's one, well, I'm sorry, just to interrupt real quick. I think that's one positive aspect of COVID-19 is that it's forcing a lot of these programs to get online, and their outreach is they're going to be able to connect with more people. So if in the past, if you lived in an area that you couldn't travel to a support group or whatever, now there are options increasing. And I think that's an exciting opportunity.
And I think the men that I see in clinic, which kind of comes back to some of the questions, is that ideally they need kind of three key things. They need to be taught how to do functional weight-bearing pelvic floor exercises correctly, and that is not easy. They can still access that online. You know, lots of us who see lots of men are still, lots of us are online, or in lots of places, people can still go and attend a point. So my good friend Joe Milius, who you know also, Joe's clinic is operating as normal because Australia is well ahead of this. So they need to see someone to go through the pelvic floor work. Then they should be attending a pump clinic. So that's a vacuum pump. They should at some stage be taught how to use a vacuum pump. And they will be taught how to use that by either a urology nurse, a male pelvic health physio, or some companies run the pump clinics themselves. And also they should have a medication review from either the urologist or physician. And that still needs to happen, even if they're not doing those face-to-face appointments. So I think that although the traditional appointments may not be happening as much, it's for those men to really, you know, that support is still there, but it might be delivered in a different way. And I think a bit like you and I have had to adapt, you know, the patients will adapt as well, and that support is there. I think another question was that because a lot of these men are at home all the time, some of them have said that that's almost making their condition worse. And that's more the pelvic pain patients. And we see these with the female pelvic pain patients as well, is that if you're home working, even though you're doing maybe the same type of job, say for an office worker, if you're home working, you can be much more static, and you're sitting on maybe a couch or a kitchen. So your body gets a bit stiffer, your hips get stiffer, your spine gets stiffer, you're not sitting in an expensive office chair. So that can be one reason why things have got worse. Also, we're not allowed to exercise as much. And we know that pelvic pain likes movement. It's better with movement. It's better with some light exercise. And also, it may be that the condition has got worse, not due to any change in the pelvic function or pelvic floor, but change in the COVID environment. That stress anxiety is making it worse. So it's almost a case that, you know, for those men to continue with the regime they have, if they have one, so that they continue doing the relaxation work, their hip, spine stuff, their stretches, they continue doing some type of modified exercise, and just having that belief that the reason they're having a flare up now is more due to the stress anxiety of COVID-19 rather than anything big happening within the pelvis or pelvic floor or those pelvic nerves.
Excellent. Fantastic. Any other question you want to share before we wrap up this segment?
I think one last thing was, is that a couple of people mentioned that because they had a lot of time on their hands, they were just spending a lot of time looking up stuff on Google, like. And, you know, I'm a big believer, as are you, that, you know, especially the men need to be informed about these conditions. They need to know more about it. And I find once you explain that maybe they have pelvic pain or they have hard flaccid, and explain why it's leading to bowel and urinary problems, that starts to address some of the stress and anxiety. But what's not good is constantly Googling male pelvic pain, erectile dysfunction, because within a few clicks, you're suddenly into stuff like penile implants, jelqing, really stuff that just gets more anxiety. So it's to try and encourage people maybe to try and draw away from that, which is not easy. And, you know, for the guys who, you know, people are at home a lot more. People need something to do, so people will be probably masturbating a lot more. But I look at that as almost a type of exercise. You know, if someone has got some symptoms, if someone's got some knee symptoms and they're a runner, you've got to say to them, okay, well, we don't want you running 7 days a week because you've got knee pain. And a bit like the masturbation, we say, okay, it's still okay to masturbate, but you need to just draw back a little bit. Let that tissue recover, rather than pushing it and pushing it and pushing it.
Good. Excellent.
More Netflix.
Yes. And so if you guys haven't looked at Gerard's, I'm sorry that I'm still struggling, but I'm going to get it. If you haven't looked at his YouTube video, it's on our channel and it's called The Dangers of Jelqing. And it's just a couple minutes long, but it's fantastic. So check that out.
And I just like to say, I'm not jelqing in it.
No. He's only talking, and he lets you know what it is and some of the dangers. So I appreciate your time today. Thank you all for joining us. Please share this with your friends and your family. I think that, you know, you touched on something earlier, like everyone or most people are going to know someone that is impacted by prostate cancer. And so if you have an uncle or a father or a grandfather or even an older, you know, coworker, and you know that they had surgery, and then you see that they might be more depressed or they might not be as active and they're not coming to events and things, even just a simple link, hey, check out this video, or, you know, you never know how you can impact the people around you. And so don't be afraid to bring up an, you know, potentially uncomfortable topic, because you could be that person that gives them the light, because there's still a lot of people out there that don't know what options are available for help.
And where you see the big difference that male pelvic health physio can make is once you see these men down the line, when they're no longer leaking, when they're back socializing, they're maybe back at work, or they're back looking after their grandkids, or their back being intimate with their partner, you see a different person. These people walk into the clinic as quite fragile, broken men. Down the line, you see the real person emerge, and you also see the toll that this has on their partners, especially those who maybe it's the partner that has made that initial phone call. And I know that for some of those men to come, that's probably been a tough few weeks or months at home with their partner convincing them that there is a problem and let's try and get it sorted out.
Exactly. So thank you. And thanks to each one of you, because I know that now that you're enlightened, you're going to share this with someone. We appreciate your time. Thank you for joining us, and we'll sign off.
And a big thanks to all the people who submitted questions, because that's not an easy thing to do either. So thank you.
Absolutely. Thanks again. Bye-bye.